To help contain transmission of coronavirus, the Centers for Disease Control and Prevention has issued guidelines for social distancing. For some, that has meant limiting the number of people in a gathering or encouraging people to keep a distance of 6 feet from others. Joining me now is Crystal Watson, senior scholar at Johns Hopkins Center for Health Security. Let's get a kind of a basic understanding here. When we talk about social distancing, is it about the physical space just around ourselves or lots of other behaviors?
Yeah, it's about physical space around ourselves. That's the fundamental, but it's also about not going to places where either you could be exposed to many people or you could expose someone if you're ill and maybe even don't know it. We're seeing some more indications that this might be transmitted pre-symptomatically or asymptomatically before people have symptoms. And so sometimes we won't even know that we're infected with the virus.
A lot of people say, hey, listen, I understand how that should work for the elderly or the frail. I'm healthy, I'm young. Why should I engage in this distancing?
Right. So we're taking some pretty big steps here to cancel schools, to work from home. Those are all big things that are causing us to sacrifice a lot collectively. But the reason we're doing that is because we want to protect those older individuals and those people with other underlying conditions that might be more susceptible to severe disease if they get infected with this virus.
And so far, we have heard that this is not a virus that's affecting children nearly as much as previous ones. So the raging debate, at least in the city of New York and other places, are should the school districts stay open?
Right. It's a really hard call. We always want more information than we have in these types of crises. But what we've seen so far is that children, in large part, don't get as sick as other people. But what we don't know enough about is whether they are drivers of transmission of this virus, whether they are actually spreading it when they're asymptomatic or mildly symptomatic. So it's a hard call to make. There are a lot of downstream implications of closing schools, but I think in the places where they have been closed, it's a good thing to do to really respond to this virus and be conservative here.
So, how does a society go on functioning in the terms of, well, when we start to think about closing small businesses, that's kind of the lifeblood of most economies. If you start to say, hey, if you're a restaurant, go ahead and space everybody 3 feet apart, might not be profitable enough to stay open, right? So,
Right.
what are some things that we can do to try to get through this and have some semblance of access and keep people employed?
Well, I think a big business through this crisis is going to be deliveries at home. So if companies can change their practices and be able to create deliveries instead of having people come to restaurants, that's going to be hugely helpful. But this is going to be a time of sacrifice for all of us, and so we need to band together to really um, do what we can to limit the spread, and that way, hopefully, we will get through this all together, and the damage won't be so bad.
So far, have we learned that this is something that gets out of your system if you have it, if you have mild symptoms, you're one and done, or if you have to be hospitalized, are you done then? Is there a possibility of this thing recurring in an individual's body?
Yeah, that's another big scientific question that people are working on right now. We have seen some recent research on this, but we really don't understand enough to be able to know if you're going to get reinfected with this virus. We do have experience with other coronaviruses where that cause common colds, and people do get reinfected with them, but we just don't know enough at this point.
One of the questions we had from viewers yesterday was should we be going to non emergency standing doctor's appointments where there's lots of things that could go wrong with our health besides this virus? What's the
Right.
balance between making sure that I stay healthy for other reasons and trying to stop from getting this?
Yeah, that's an important balance. And I would suggest the best thing to do if you have an appointment and you're not sure if you should go to the doctor's office is to call your doctor, have a conversation with them. They can help you decide whether it's worth going to the doctor where there might be other people who are sick or whether it's better to stay home and reschedule for a later time.
I'm personally guilty of this. I went to the gym yesterday almost out of habit. I showed up, I did what I did, and then I was thinking about what was happening in there. Are gyms
Yeah.
good places to spread this kind of thing?
I think any place where you're gathering together in big groups and in close quarters, there is the possibility of spreading the virus. I understand the need to go to the gym. I think we need to keep both of our mental and physical health up if we're going to get through this together. So, if you do go to the gym, I would say don't take part in those large classes. That's probably an area where there could be more contact and spread. And if you use equipment to wipe it down before and after, wash your hands really well, and that'll help limit.
Is there, are you optimistic that this is going to reach some sort of peak in the next few weeks for the United States based on the data that we're seeing country after country?
Yeah, based on the data we're seeing, both outside of the U.S. and in the U.S. now, I think we're still seeing just the tip of the iceberg in terms of cases here. So, I think we should buckle in for a little while.
Yeah.
I am not optimistic that it will just be a couple of weeks.
All right. Crystal Watson, Senior Scholar, Johns Hopkins Center for Health Security. Thanks so much.
Thank you.